So thank you so much, Partha, for making me a part of this symposium. And the talk that I've been asked to deliver is on computer vision syndrome and its relationship with dry eye. It's a bit of a didactic talk, but at the end of this, I will come up with some small pearls which would be useful in giving and offering therapy to these patients. There are no financial interests of any relevance in this talk. So the computer vision syndrome is now called digital eye strain, or DES, and it is the continuous usage of digital devices that has led to an increase in this. And it's characterized by eye strain, dryness, and blurred vision. And this broad range of these eye vision related symptoms is now collectively called as digital eye strain. The wide availability of the internet has revolutionized information technology, and now there are smartphones, there are tablets, and there are other gadgets. And in 2020, the pandemic has now created a sharp increase in the digitalization of almost all these activities. A major component of digital eye strain is actually dry eye. So there are other aspects to DES as well. And DED, as we know, is a multifactorial condition and is characterized by a combination of ocular surface symptoms and with signs as well. The prevalence of digital screen usage, just to give an idea, is that it is an average of 5.5 hours a day. And with mobile phones, desktops, and laptops and other devices in the US, 78% of adult Americans own computers, and 77% have smartphones, 51% have tablets, and 22% have e-readers. It's estimated that adults in the UK spend more than 4 hours daily using digital media, and there's similar data in the US. In large-scale population-based Japanese studies, dry eye disease was higher in those who spent more time on these screens rather than those who did less time on these screens. And in women, the study showed a similar high prevalence, but even higher than they were seen in men. In India, too, there was a study conducted in undergraduate medical students in Srinagar with smartphones and tablets. And for those who used the screen for 1 to 2 hours, about 41% had a dry eye. Those who used it for more than 2 to 4 hours daily, the prevalence was 75%. And for those using the screen for more than 4 hours, 93% had a dry eye. The commonest symptom again was eye fatigue, followed by headaches and blurred vision. This is the breakdown of the symptoms of digital eye strain based on the type of exposure, with the vision related, both refractive and oculomotor, and ocular surface related, where there is blinking and contact lens wear, and the pathology of the tissues that are involved. But eventually they all lead to a decrease in blink rate, the decrease in amplitude and the lens eyelid interaction. There's an uneven tear distribution and instability of the thin tear film, and an increased friction, which then leads to the multitude of symptoms that we see. When we talk about refractive issues with the digital eye strain, it's largely the refractive error, the presbyopia, which creates the problem. And then excessive use of screens creates oculomotor problems as well. And when there are associated phorias and accommodative or vergence issues, then there is a fixation disparity, and there is all the fluctuations that are there leading to blurred vision and diplopia. Similarly, the use of handheld smartphones and tablets, PCs, and concomitant blinking loss, as well as contact lens wear, sets up a kind of symptomatology which is vision related, ocular surface related, and device related, as can be seen in this table. The increased computer usage, as we can see, is well documented. 2.3 billion people in Asia, as well as a vast majority of people in Europe and in North America, use some form of smart device like a computer or a laptop, and they are the ones who are primarily at risk. So why does computer vision syndrome actually occur? So computer screens are made up of pixels, and these are hard for the eyes to focus on continuously because they keep getting refreshed. And the user must therefore focus again and again to keep the images sharp. And this results in a receptive stress of the eye muscles. And the dry eye part occurs due to the drop in the blink rate, which drops from an average of 14 times per minute in normal individuals to 4 to 6 times a minute during computer and screen use. So here are some commandments in a sense that one can suggest for people who are having dry eye. One is get a comprehensive eye exam, and computer users should have an eye exam before they start working on computers and once a year thereafter. And this is a recommendation of the National Institute of Occupational Safety and Health. And use proper lighting, because eye strain often is caused either by excessively bright light, and in many offices, both outdoor as well as interior, the ambient lighting should be about half as bright as that typically found in offices, and must eliminate the exterior light by closing drapes, shades, or blinds, reduce the interior lighting, and position your computer monitor or screen so that the windows are to the side instead of in front or behind. Minimizing the glare, using anti-glare screens, using lenses with an anti-reflective coating, and the glare on the walls and finished surfaces can be treated. Upgrading the displays with LCD LED screens, which are better than the old tube-style monitors, and choosing screens with a higher resolution and relatively large displays. Adjusting the computer display settings or off on the screen. So as you can see on this, on the table on the right, a computer screen with black text on the white background is best, and other high contrast combinations also work well. Low contrast texts and background color schemes don't work that well and give more strain, and text on a busy background is also tiring to read. Blinking more often is very important, and every 20 minutes one should blink slowly, like as if one is falling asleep, by about 10 times. And the use of eye exercises by constant focusing on screens, that the screen, the strain and the tiredness and fatigue that sets in. One must look at the computer, look away from the computer every 20 minutes and follow the 20-20-20 rule. Look far away at an object for 10 to 15 seconds, then gaze something up close, and then look back at a distant object. And this repeated often prevents accommodative spasm. And don't forget to blink during these exercises. Taking frequent breaks, again, is very, very important. And one needs to also sometimes stand up, move about, stretch arms, legs, back, and the neck to reduce tension and muscle fatigue. Computer eyewear can be specifically modified to create computerized glasses which are customized. And these are good for you, especially if you wear bifocals or progressive lenses, and especially true if one normally wears contact lenses, which may become dry and uncomfortable during sustained computer work. And lastly, to modify the workplace by placing written pages on a copy stand adjacent to the monitor, positioning the computer at a proper height and at a proper distance, lighting the computer stand properly, make sure the desk lamp doesn't shine into the eyes or reflect, and adjust the workstation chair according to the correct height. So to summarize, computer vision syndrome is now known as digital eye strain and is gaining prevalence. It occurs due to the constant focusing of the eyes on a computer or other screens for a long periods of time, resulting in inability of eye muscles to recover. And this also results in a chronic dry eye. It just doesn't occur through the use of computers. Other devices contribute equally. And one of the major reasons for dry eye disease, at least in the current scenario, is the digital eye strain produced by these devices. One should follow the 10 commandments that I have listed, and to avoid a dry eye, effort should be made to use tips which stimulate tear production as well as the conventional therapies. So thanks very much. I hope this topic is open. I'll stop sharing my screen.
Thank you, Rishi. Thank you. This was really very nicely summed up. And we have Rajesh. Rajesh, your comments on this?
Yeah. Thank you, Dr. Partha, for commenting on Dr. Rishi's presentation, who is always very meticulous in covering up everything. And very rightly pointed out that, it's the digital eye strain. Basically, computer syndrome, the terminology includes a syndrome, which means that it's a multi-system, it's affecting multiple systems. And computer vision syndrome includes everything, which includes your bad posture while, watching the screen. So you can have neck problems, you can have back problems, you can have multiple such things. So that's why very rightly pointed out digital eye strain, about which we ophthalmologists deal with. And I guess most of the things have been very rightly pointed out. Apart from all these points that have been pointed out, the mainstay of treatment again remains the same. We have to give lubricants because mostly it's the evaporative type of dry eye that happens. But what happens that with the chronicity of the problem, there is subtle inflammation that sets in, and that sometimes even with a little bit of lubricants, it doesn't help. So maybe surface reduction of surface inflammation by something like cyclosporin, etc., will help. That is one. And apart from the 10 commandments that Dr. Rishi was mentioning, I think we all ophthalmologists are very much prone to develop these digital eye strain, particularly in this COVID era when we are switching from one webinar to the other and having multiple hours sitting in front of the laptop screen. So that is definitely there. And I guess all these points regarding blinking, regarding, taking a break, etc., needs to be emphasized amongst even our peers so that we also don't, get into a severe kind of a digital eye strain.
Right. Thank you, Rajesh. What was very important from Rishi's, he said it is a didactic lecture, but I think it was a very, very practical lecture. But do we as ophthalmologists, can we spend that time, that chair time with our patient of dry eye, with a workup of dry eye after being done? Do you think a good idea would be a dry eye clinic or a computer vision syndrome clinic, something that separates these patients from the dry eye patients, from the other patients, your cataract patients, refractive patients, and retina patients, and give them what is required of them? So Sonu, you have a huge cataract and refractive practice. What do you do for these patients? Do they go through all the protocols, indirect ophthalmoscopy and this and that, and then you finally say you have dry eye, and then you spend just 2 minutes? Is that so, or would you like to segregate?
So answering point-wise, I will first congratulate Rishi for that wonderful talk. And I would recommend Partha that this whole talk can be imbibed into a flyer and which can be issued by the AIOS as a public interest for this digital eye strain. I think the presentation itself speaks of the content. And I think that can be a wonderful flyer which can be released. Secondly, yes, in our practice, we have a dry eye clinic, but nothing dedicated to the digital eye strain or the CVS kind of clinic. But yes, 1 in 10 patients usually who visit our refraction clinic usually are those who have been working in corporates or the young, the tech-friendly people. And these all have been, for the last 2 years during this COVID era, have been suffering, as we all within us have been. So I think it's a great idea with the change in the new normals. I think we would be, where we would be addressing all these issues, maybe through the far reach programs of our society, where we can address right at the corporate level where they have been working, and change in their lifestyles and a little knowledge about the eye exercises, as Rishi rightly pointed out, and the eye care, and maybe some at our own clinics dedicatedly. These CVS clinics might help the upcoming generation for all this.
So Partha, I think that point that you mentioned is very true, that we need to look at these patients specifically. But what's changed, at least over the last 3 or 4 years, is I'm seeing many more people who are not directly involved with using computers professionally, who are now coming in with these complaints. The housewives, the older ladies, they're spending so much time on their mobiles and on these other tabs and this thing, that they're coming in with these complaints. The school and the college going kids, so their avenues of recreation, their avenues of information, everything is now coming from a screen. So they have no contact with the outside world. They do their schools online, and then they do their homework online, they do their research online, and then they now do their recreational activity online. So they suddenly are now looking at hours and hours of screen use, and they're coming in with complaints like this. So one never used to see dry eye in young kids, and we are seeing that now. And so that is a cause for worry as well.
Not only that, Rishi, also the follow-ups that they would require, the multiple follow-ups they would require for the same ailment. So this is what I think, Maipal sir, what would you comment on this? That should we have a dry eye clinic dedicated to these computer vision syndrome problems? so that the fallibility is there, the specific requirement is there, and the patient doesn't have to wait all that time, in an OPD, and get his worth of whatever treatment is required.
See, I personally feel that the digital era has come to stay and it is going to explode further. And as Rishi rightly pointed out, the device-related dry eye or the computer vision syndrome, that's going to increase. It is imperative that we need to educate the people. The other thing that is also happening is the environmental pollution. So that is the second thing which is causing a great increase, and suddenly the number of patients who are having these symptoms have come. And maybe the one other thing that is escaping our mind is that there is definitely an increase in the number of patients who are coming with the sudden development of myopia to us. Immediately post the lockdown or whatever it is, because of the classes and everything, the myopia is tending to increase also. So that is another thing that is happening. Dry eye is going to be something which requires chair time, and you have to work whether the your location has enough time for that, and that could be something like a refraction clinic. You could have possibly a dry eye clinic, and with the new gadgets and the new devices and the diagnosis that is coming in, it is going to be, I suppose, a gratifying thing. It won't be as exponentially great as a surgical clinic or anything like that, as a surgery center, but I think dry eye is gaining significance, and there are a lot of people who are benefiting from the treatment. So dry eye clinic is something I still remember. Again, I'll wish to go back to Professor Madan Mohan, that he had started OSD clinic. That was an ocular surface disease clinic, which I was given to handle at that particular time. So this is way back. I'm talking about in 1989, 90, that an ocular surface disorder clinic was started by him. So that is the time when things were starting to come up, and it is the foresight of people that this is something that's going to gain importance. But now I think it is really becoming a household kind of a thing, and majority of the interviews that I have given to TV channels or to other places has been on computer vision syndrome, because that's something, and the number of patients coming in with an increase in myopia. So Partha, I think it is going to be something that we need to kind of work on, and maybe have, as Sonu also said, to tell simple things to the patients or to the normal general public that this is what needs to be done.
Right.
Partha, what I feel is that it's time now that we have to give due importance to ocular surface disorder and dry eye, actually, and in our routine practice, in our day-to-day evaluation, because the number of cases are increasing. It's not that they come with a specific complaint that they are having, they have increased, screen time, and that's why they are having problems. Rather, they will come up with some other problem. Maybe somebody will come up with cataract, blurring of vision, or other things. Somebody not having significant cataract, still having blurring of vision because of surface dryness. So we have to incorporate dry eye workup in our routine workup of the patient, because number of cases with poor ocular surface or with symptomatic these digital eye strain has really increased, and it's definitely going to stay, as my pastor was telling, and we all know that the digital era is here and it's going to stay. So that has to be incorporated in our day-to-day practice.
I think the basic assessment of a dry eye and an ocular surface should become as important as doing the vision or the pressures or looking at the cup disc ratio. Those are the things we automatically do. But it's surprising that one doesn't actually look at the surface. One looks through it. And that, to my mind, at least now, especially, is not really what is required. One really needs to come back and work and look on the surface and at the surface.
So, but one thing, Partha, I'll just wish to say is, again, going back to old times, the most frequently written medicine by us 20 years ago was an astringent. We used to write Mezol or Andre or some Dapazoline kind of a situation, and suddenly we've gone to the other side, because obviously there was a misdiagnosis or a wrong diagnosis. Any scratchy red eye, you give a astringent and a antihistaminic combination that was there. And now suddenly you see that the maximum number of prescriptions that we are writing is for lubricant eye drops. So see how things have changed over 20, 30 years.
For a quick comment, so we run ocular surface and dry clinic every day at LVP. So that is just for surface and dry eye patients. And off late post lockdown, the number of patients with CVS have been enormously growing. On the software front, people who are free towards the weekends, so those days are just crowded with people from. So I think this is really something very alarming. And initially, I would just have 3-4 patients with CVS. Nowadays, I at least in an OPD, I have at least 10-15 patients. So the first time I see them in the clinic, I explain them screen time measures and warm compresses, give them a slightly extra time. And then I just tell them warm compresses on follow-up. So I thought that's the best way to utilize. So the first time I see them, I explain, give them that chair time, and subsequently I hope that they remember and then they follow.